big difference in saving a month.
Okay, I have an office that many times during the month of December, which can be slow, will do both of those things. They'll incentivize the staff by doubling or increasing their staff for filling in the holes and same-day service, but they'll also make special incentives for the patients. You know, if you can stay and do this today, we'll give you an additional 15% off.
You're already
10%.
here,
Yeah,
you're sitting in the chair.
most offices have one or the other. December or January is big, because if you push everybody to use all their insurance
December's
in
big.
January, there's no money left in December.
Right.
You know what I mean? So usually you have one or the other. And having a trick like this where we have massive deals going on for the month,
Yes.
that we talked about first, or you really push same-day treatment, can kind of even it out. And having a bad month can destroy almost like the year, the profit of the year. Having a bad month is
People
devastating.
forget too, that offering same-day service, like you said, it's a patient incentive. They like the idea of leaving with the work and not having to come back and worry about it, so forth. So you've got that incentive. All we need is the hygienist just to give them that little,
Push it over.
hey, the doctor mentioned last time you were here, you really need this.
And really, the filling the slow times trick that you ran across in California,
Mhm.
we have an opening,
It's called scheduling discount.
Yeah, the scheduling discount. We have an opening. The doctor hates openings, and he's authorized me to give a 20% discount if this can be filled. And you discussed
Well, the real drama there wasn't just that it was a big case, $30,000-$40,000, which would make you want to think about discounting. The problem was it was all cosmetic, pure cosmetic. And so there was no way to create urgency so that people would say, yeah, let's get it done. Instead, they tended to drift from office to office, getting a total and no urgency.
and never doing it. Right.
Yeah.
Right.
And you don't just offer a percentage. You don't say, and we want to fill this opening next week. Normally it's full, but the doctor said I can give this 20% discount. And if you say 20%, don't stop there. If it's $40,000, point out that's $8,000. So to get the hygiene schedule to fill up, which I think you mentioned, one of the approaches is to have a membership program. In other words, you pay a membership fee to get a discount.
Mhm.
And for example, the membership fee might be $149 or $97. But for that, you get 2 cleanings. And man, they do the math pretty quickly. They can see that by being a member, it's cheaper to come in here and get my teeth cleaned and get my exam than it would be otherwise. But you got to remember, the real key there is the chairs are full of people that are going to need dentistry. Some of the offices have to give you an idea, there was some that were so threatened by the 2008-2009 financial slowdown that the offices had gone from maybe $325,000 a month to $125,000 a month. They were laying staff off, moving to smaller spaces. Some failed and had to go be associates. It was a difficult time. One of the things that saved them, some of them, was membership. And they would, all of a sudden, hygiene was full. And with hygiene full,
You've got dentistry.
Yeah.
What we tend to see here at Whitehall with an office doing a lot of same-day treatment, starting the month off on August 1st, if you're at around 50% scheduled to goal for the month, you have a shot at hitting your goal. If it's 40, 35%,
it's gonna be tough.
it's going to be tough. And that's when you got to, get creative, running deals, calling people.
More marketing.
More marketing, and running these specials. And you might even run them case by case. You got 20 people that you have seen over the last 2 months that didn't accept the treatment because the treatment was larger. It was $5,000, $6,000, $7,000. Getting on the phone and saying we're doing a training day and we can knock 25% off of that $7,000 worth of treatment. You get on the phone and you fill this thing in.
Now,
You do what you got to do.
The doctor doesn't make the calls. It's key staff.
Yeah, we have staff that will, at the end of the month, as they're running a little short, $9.99 crowns sell real well to new patients. Instead of you do $1,200, $1,300, $1,400 at the end of the month, running the $9.99 special to just hit their monthly goal has worked historically in practices. So that's another trick.
Well, there was a time in dentistry, and Dr. Peters said being from the Mesolithic era or whatever,
Pre-Jurassic.
yeah, pre-Jurassic. There was a time when if you would have used the term discount in relation to trying to fill the schedule, some doctors were so polite they wouldn't have said something unkind to us, but their stomach would have grabbed,
Yeah.
discount. Isn't there some way I can fill this up just with my awesomeness? What about that?
Sometimes, yeah.
Good luck.
Yeah,
It's really
I mean,
awesome.
sometimes- if you're consistently hitting 100,000 a month, and that's kind of where your overhead and you kind of start to make money, and you're looking at a month and you're going to do 80, you're looking at making nothing or close to it. You know what I mean? And so filling it in with discounts and being able to hit the 80, even though that last 20 was discounted, and you would have done 110 or 115 to do it, that's kind of how you got to look at it.
Some people too don't realize that